Hello, gorgeous girl. Happiest German Shepherd in the world. Your call made me think that she's maybe not so happy at the moment.
No, she definitely isn't the happiest dog at the moment. She's been having a lot of pain in her rear legs and a lot of trouble actually running and walking and standing.
Well, before I have a little feel, what I might ask you to do is if you can just walk her up and down the pathway here and I'll have a little look and see what I can see.
Okay.
Yeah,
You want me to walk
okay?
or run her? Or
Well, let's start with walking, and then I might get you to do a bit of Usain Bolt. We'll see. We'll see.
Okay, I'll do my best.
Okay, have a little walk and we'll see.
Come on, Hannah, come. Hannah, come.
I ask Lee to trot out Hannah just so I can see her moving, and straight away I can see there's a problem. Certainly not normal. Hannah is actually walking very strangely on her ankles and actually almost falling down on them, leaning back and just pushing right down to the floor. It's a very odd gait and certainly something that I need to get to grips with. Let me just have a feel of these ankles then. Good girl, you're being such a good girl. Hey.
That hurts. You can tell that when you went to that area of the rear leg, she turned with her ears back and she feels pain.
After examining Hannah, I can see that there's lots of little things, but I don't find that they add up to the major problem, which is that this dog is walking very strangely on both back legs. There's a spectrum of possibilities here, though, from something quite mild. It could be just a ligament strain. It could be a little bit of early arthritis, right up to really quite severe things, with the worst case possibility being some type of cancer. When we see dogs like this that are lame suddenly, cancer is a possibility. The worst case scenario is something called osteosarcoma. It's an exceptionally aggressive tumour that grows very, very quickly. And unfortunately, in a lot of cases, the dog can die very quickly. I know how much you love this dog, I do. So what we need to do is just to look at this a little bit deeper, and the way we can do that is with X-ray.
Right.
So I am going to take you, devoted owner and beautiful dog, back to the practice, and we're going to look into this further with X-rays.
Okay, thanks, Scott.
All
Thank you.
No
Thanks.
worries. No worries. Hey, Ems.
Hi.
Hey, I've got the gorgeous Hannah with me.
Hi, Hannah.
Hey.
Hello.
Hi.
Emma is needed to help Scott find out just what's wrong with
Well,
Hannah.
she's walking very weirdly.
Okay.
Yeah. We just had a little walk in the park, actually, with Lee, and she's walking really quite strangely, so we're going to do a few X-rays.
Sounds
All right?
good.
Do you want to hold her for me and I'll
Hannah
get an
does.
IV in? Yeah, good girl.
Oh, such a good girlie.
You know what is quite weird? Looking at the front legs, her wrists are doing the same thing that her ankles are doing in the park. And that they're actually bending quite significantly downward. So I'm a little worried that her ligaments across the board are just a bit weak. There's no strength or support to any of her joints.
Owner Lee is upstairs, anxiously waiting for news. Since the age of 5, she has always had a German Shepherd in her life.
Maybe they're not human, that's true, but they're as important to me as humans. That's just how I think about them, so they're just integral part of my life. I couldn't live without having my German Shepherds. I don't think I'd be a very happy person.
Okay, Lee, so your little lady is absolutely fine. And we've just put a little IV catheter in, and then we've just given her sedation just to take the edge off, and she's nice and calm. So do you want to join me downstairs?
Yes.
You can comfort her while we X-ray.
Great,
Yep?
thank you.
Come on down. Normally, we wouldn't ask an owner to join us in the X-ray room, but I knew that I couldn't fight her off, and she really wanted to be there. So I thought, you know what, it's going to comfort little Hannah, so why not? There she is. So grab a little pew there. We just put this on so it keeps her nice and sleepy. So there's your girl. Okay, she's absolutely fine. Nathan, doing well?
Yeah, really good.
Good job.
She's a strong dog. Mama's here, sweetheart.
Good. All right, so whilst you're giving her lots of love and cuddles, we're going to crack on with the X-rays, okay? So, it's understandably worrying times for Hannah and her owner Lee. The worst case scenario could be cancer development in some joint, which is very common in German Shepherds of a certain age, all the way down to just a mild amount of arthritic change. So at the moment, we don't know what the problem is, and we certainly do have a very worried owner in Lee. Out we go, everyone. Okay. Right, X-ray.
It's never nice to see your dog sedated because, you know, their tongue is hanging out and you don't really know, because you're not a doctor, whether she's breathing or not or how she's doing. It's always a risk anytime a dog is sedated.
Okay, honey, they're almost done.
The X-rays are now completed. Lee is about to find out what's wrong with her much-loved Hannah.
The good news is that it's not cancer.
That's great news.
Yes.
So that is, makes my day.
Absolutely,
Year.
absolutely. Yes, and so look, we can deal with everything else because the worst case scenario is now off the table, so phew. But the little changes that are present, I don't think quite add up as to why she's walking so weirdly. I mean, she's walking weird, isn't she? I mean, I think that's the official diagnosis. Yeah, I'm just going to give her a reversal and should mean she wakes up nice and sharpish.
Lee is relieved that cancer has been ruled out, but Hannah's medical mystery is far from solved.
I'm not comfortable with that situation. I like to know exactly what's going on, and in this instance, unfortunately, I don't.
Okay, Mama's here, honey.
So Hannah will now be referred to specialist orthopedic surgeon Michael Hamilton.
Well, Lee, I'll leave you to have good snuggles with your little lady.
Okay, good.
And I will put a call through to Michael and see if we can organise that appointment.
That sounds great. Thanks, Scott.
All right,
Thank you very
worries.
much.
Oh,
Thanks.
beautiful.
That's my girl. Come on.
Meanwhile, in Buckinghamshire, orthopedic specialist surgeon Michael Hamilton has fast-tracked an appointment for Lee.
And just slowly across in front of us.
Under his expert eye, 7-year-old Hannah is being put through her strange-looking paces.
Hannah? Hannah? Not knowing is always a little bit nerve-wracking, what the real issue could be, whether it's something that he feels he can address or correct, or whether this is something we're just going to be dealing with Hannah.
Okay, I'm back again.
Yeah, a little trepidation there, but of course we came out here because we're looking for the solution and trying to really give Hannah the relief she needs so that she can get back to normal.
But Michael's diagnosis is not what Lee was expecting.
From my point of view, the most obvious thing is her wrist joints.
On the front?
Yeah.
Okay.
Both of her wrist joints are actually kind of collapsing. So dogs, as they walk,
Yes,
they've got wrist joints like we do, but they walk up on their toes like this.
Yes.
And the angulation between their wrist and their foot is usually maybe up to about 30 degrees like this. Now, when she walks, this is almost going down to 90
Like
degrees.
that,
She's almost
yeah.
walking on her hands like this.
Oh my.
It's called hyperextension, which basically means that the wrist joint just extends more than it should do.
Right.
And the implication of that is as she walks, she can't physically kind of push because the whole wrist joint just collapses. Because of that, I think she's thrown her weight back onto the back legs,
which is why she looks walking odd.
She just looks a bit peculiar.
Yeah, she looks arthritic.
But the good news is we can usually do something about it.
Great.
So,
Okay.
yeah,
Great.
good.
Thanks.
So let's go back to the clinic and we'll have a good
Okay,
old feel.
great.
So, okay.
Well, my hopes is that we don't have to do anything invasive.
Okay, come on in, Hannah.
I really would like to try to avoid doing any kind of surgery on Hannah. It's always a risk and the results aren't always clear.
What we need to do is put the wrist at a more appropriate angle and stop it doing this.
Right.
And what we do is we fuse the wrist joint with a plate and screws.
Okay.
On both sides. But any pain that she does have will go away. But the most important thing is she'll be able to push off because the thing won't collapse because it's going to be fused.
And what happens if we don't do that?
Yeah, if we leave things, she'll probably just get progressively more and more hyperextended to the point that eventually she'll be walking on the backs of her wrists, and then you start to get wounds and sores and all the rest of it. Yeah. So I mean, it's
not an option, but I just wanted to ask what would happen.
I mean, the prognosis is good.
Okay,
the prognosis
great.
is really
Great.
good. Yeah.
Good.
It's quite a big procedure, particularly if we're going to do it on both sides at the same time. The potential risks are that the joint just doesn't fuse, because it's, not to make it sound too dramatic, but it's a bit of a race against time that the joint fuses together before the implants fall out.
Okay, sweetheart.
The decision is now up to Lee, but she's clearly torn about whether to put Hannah through major surgery.
And it has been really exhausting, going through this, because it's like trying to find your way out of a maze, of sorts, to what's the right thing.
Let's have a little feel here.
The puzzle pieces are now fitting together, but that last big piece is going to be the surgery.
She's got a bit less weight on this front right leg.
Yeah, I see that.
I'm really concerned because, as her mother, I have to nurse her back to health. I'm ready and I'll get her prepared as well. She's like her mommy. She's tough. She's tough. What a good girl you are. Daddy's gonna pass it now. Go ahead.
4 weeks later, after a lot of soul searching, Lee and her husband Chiro have made a surprise decision about Hannah's surgery.
I had several kind of sleepless nights where I was trying to process so much information about Hannah. And, you know, part of you wants to go right to a solution because I'm kind of a fix-it kind of girl. And in a way, I had to consider is there a smarter way to do this that isn't as extreme as the step of fusing her paws? I had to wait for a sign, and the sign really was Scott calling and saying, wait a minute, I think we got a solution here that can give her the kind of help she needs.
Come on, Ann. Gonna go see Dr. Scott.
Yes, hello, gorgeous. Look, I've got your shoes.
Come on.
Yes, look
Wow.
at this. What's this thing? Hey, what's that? I think these supports could be the answer to Lee's prayers. She's not that keen on surgery, and that's fair enough. What are we doing?
Oh my goodness, that's so pretty.
doing?
Wow.
And it's been tough actually waiting for the braces because when I watch her walk in the park, I can see how far down she is on her pastern, and that's upsetting. So now to see her lifted up like this, it's great.
Good girl, well done.
Very good, honey.
Certainly when I placed the supports onto Hannah's forelimbs, she wasn't the graceful shepherd that you would expect. She kind of looked like maybe she'd had a few too many.
Okay.
What's that feel like? Is that weird? Yeah,
I know.
I know. But you know what? She will get used to it. And what it will do is just rebalance her whole body. Hey?
Very good.
All the while looking very stylish.
Very, very stylish. Very stylish.
Yeah.
Yes.
I think that these supports are the right thing to do, but eventually I believe that the perfect world would be to have them supported permanently. And the only way to do that is with surgery. But you know what? You have to respect the owners and you have to respect their love and their understanding of their own pet. You ready to go out and hit the street? Show everyone your new shoes?
Yes.
Hey, you ready to go? All right, well, good luck.
I feel like we made the right decision for our baby, yeah.
Come on, Hen. That's a girl. Go slow.
If you guys loved that video, great. Make sure you subscribe to our YouTube channel below. That way.